Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm doing another Kahoot, but I'm going to be covering childhood communicable diseases, and this is going to be part one of a two-part series because there are a lot to cover, and I can't get it all in one Kahoot. So it's going to be two parts. As always, I'm going to ask you to please support me and support this channel by liking this video, giving it a thumbs up, pressing that red notification bell so you can be notified every time a new video is released, and subscribing to my channel if you haven't done so already. Something else you can do is share my content. If you know someone in the nursing program that's struggling or even thinking about the nursing program, maybe you can share one of my videos with them or even on your social media platform. And don't forget, guys, I have audio lessons available on my website, and now you can also book for an NCLEX review, the NGN, the new item review where I go over the new types of questions you should expect and the content that you should expect to be covered, and just very important things that you should know and test-taking strategies. So guys, with all of that said, let's get started. The varicella-zoster virus is the agent responsible for which disease? Chickenpox, diphtheria, erythema infectiosum, or mumps? What do you guys say? The varicella-zoster virus. Good, 103 people answered. Good, most of you guys got it right. Chickenpox. When you see varicella, you need to be thinking chickenpox, right? Very good. Next question. This is a select all that applies. How is chickenpox transmitted? Select all that applies. Remember, guys, you treat select all that apply as true or false. Direct contact, droplet airborne spread, hair follicles, or contaminated objects. How is chickenpox transmitted? Okay, so let's talk about this. This will select all that applies. Direct contact. Yep. So the patient has chickenpox and you touch them, you touch the lesions, you can get it. Droplet airborne spread, and the droplet airborne spread, that's usually what NCLEX wants to know that you know about. Absolutely, those particles could stay suspended in the air. That person coughs, they sneeze on you, those droplets it comes into your body, you can get it. And contaminated objects where they'll touch something or that lesion and then you touch it, but not hair follicles. So everything except for hair follicles, that's how it can be transmitted. What is the treatment for chickenpox? Antibiotics, antitoxins, high dose steroids, or antivirals? What do you guys think? Okay, so it's antivirals. Chicken pox is of a viral nature. Okay, by the way, when you see the description for chicken pox, you'll see those lesions, vesicles. Whenever you see vesicles, 98% of the time, it's going to be of a viral nature. Okay, now there are some skin disorders where you see vesicles and it's of a bacterial nature, but usually it's going to be of a viral nature. And chickenpox absolutely is of a viral nature. That's why we're going to give antivirals. Now, antibiotics we would give if it was a bacterial nature. Antitoxins we would give for some type of medication, some kind of disease process, I should say, that there was a toxoid. High dose steroids we would give for something like if the patient had some type of large inflammation happening in the body. But chickenpox is of a viral nature. We're going to give antiviral agents. True or false? To prevent chickenpox, the patient should be immunized against it. Is this true or is it false? There are more than 84 people in this room. Come on, everyone needs to answer. It's true. It is absolutely true. I'm so sorry to the anti-vaxxers. Don't come for me, come for the CDC. But it is absolutely true. The best, most effective way to prevent chickenpox is to be vaccinated against it. So this is true. Select all that applies. So nursing interventions for chickenpox include select all that applies, maintain standard airborne and contact precautions, keep the child home from school until the vesicles have dried, administer skin care, keep the child cool, teach the patient to pat or rub, not to scratch, and avoid the use of aspirin. So this is a select all that applies, so you can choose more than one answer. What do you guys think the answer is? Okay. Nursing interventions for chickenpox, all of them. So let's go through them one by one because I want to explain this to you. The first one, maintain standard airborne precautions. Absolutely, because you want to prevent the transmission of chickenpox to others. Next, keep the child home from school until the vesicles have dried. And NCLEX expects you to know this. Guess what? Those vesicles have not dried over. They are still contagious, and they can give it to the other kids at school. Administer skincare. Absolutely. Why? Because with chickenpox, it's very itchy, and so the kid's going to want to scratch all the time. With them scratching, they can cause themselves to have lesions. They can open up the skin, and that's a perfect environment for bacteria to settle in into that cut. And now, originally, the patient had a viral infection, which was chickenpox, but now they got a secondary infection, which is bacterial, because they were scratching so much. So you want to provide skincare, keep the skin nice and moisturized. Next, keep the child cool. Yeah, because one of the clinical manifestations that you see with chickenpox is going to be a fever. They'll have a temperature, so you want to keep them nice and cool. And you want to teach them to pat or to rub those lesions and not to scratch. And if it's a younger child, they can't control themselves, you're going to have to put mittens on their hands, because what we don't want is for them to get a secondary bacterial infection from scratching or damaging and opening up their skin. Lastly, avoid the use of aspirin. We never use aspirin in children, especially if they have a viral infection. What can we give them? Ray's syndrome. That's what we're concerned about, Ray's syndrome, okay? So all of these are nursing intervention for chickenpox. True or false? The mode of transmission for diphtheria includes direct contact with infected persons, a carrier, or contaminated articles. So now we're switching gears. We're talking about diphtheria. What's the mode of transmission? Do you guys agree with the statement? Is it true or is it false? True. True. And diphtheria, guys, diphtheria can cause like massive inflammation of the mucous membranes. It is not a disorder that you want to have. Select all that applies. What are the symptoms of diphtheria? Symptoms of the common cold: sore throat with low-grade fever, lymphadenitis, also known as the bull's neck, hoarseness, vesicular rash, butterfly rash. What do you guys say? You guys don't like answering the select all that applies, I see. Okay, and let's go over this. So the correct answer is signs of the common cold. So they will have, they will be coughing, they'll have the runny nose, they'll have sore throat, low-grade fever, that lymphadenitis. You know how you have the lymph nodes in the cervical area? They'll become inflamed, very enlarged, okay? And that's what we call that bull's neck. They'll have hoarseness in the throat. All of these are true. These are signs and symptoms of diphtheria. Vesicular rash? No. Again, let me tell you something. When you are in doubt and you just have no clue, just think vesicular rash goes with viral infections. It's not likely that they have vesicular rashes are bacterial infections, okay? That's false. And what about butterfly rash? False. When you think of butterfly rash, what disorder or disease are you thinking of? You're thinking of lupus. We're not talking about lupus. We're talking about diphtheria. True or false? The therapeutic management for diphtheria includes equine antitoxin, antibiotics, and complete bed rest. True or false? Very good. Most of you chose the correct answer. It is true. That's how we treat it. They get the antitoxin, they get antibiotics, and they have to be on 100% bed rest. They need a rest. True or false? Childhood immunization is the preventative measure for diphtheria. What do you guys say? Is it true or is it false? Very true. Yep. Number one way to prevent it is to get vaccinated against it. The slap face appearance is a classic symptom of which disease? Is it chickenpox, diphtheria, erythema infectiosum, or roseola? The slap face appearance. Now look at the face of that infant. Does it look like someone just slapped them? Look at their cheeks. How are you guys doing on the live? Make sure you're putting your answers in. Okay, most of you guys went with roseola, not so much. It is erythema infectiosum, but we are going to talk about roseola, so I don't want to say too much. Before I move on to the next, no, I'm gonna wait. True or false? Erythema infectiosum is also known as fifth disease. I'm so happy I didn't speak. True or false? What do you say? In erythema infectiosum, is it also known as fifth disease? True. True. So you know how erythema infectiosum, they have that slap face appearance. You look on the cheek and it's all red. Well, I want you to think about it. It takes 5 fingers to slap someone. So that's how you can remember that slap face and fifth disease. It takes 5 fingers to slap someone. True. True or false? Fifth disease is transmitted by respiratory secretions, blood, and blood products. Now look at his face as well. Look at his cheeks, just as it's red, as if someone just slapped him on the cheeks. Is it transmitted by respiratory secretions, blood, and blood products? True or false? True. True. Select all that apply. What are the clinical manifestations of erythema infectiosum, also known as fifth disease? What are those signs and symptoms we expect to see? Erythema on the face, slap face rash that disappears by 1 to 4 days, Stevens-Johnson syndrome, self-limited arthritis, itching, and no clue, Professor D, I give up at this point. What do you guys think? Select all that apply. All right, so let's talk about this. Fifth disease, erythema on the face. Well, yeah, look at that redness that we saw on the cheek. Yeah, they're going to have that redness on their face. True. That slap face rash, absolutely. We've been talking about this. They're going to have it and does disappear by like 1 to 4 days. It doesn't stay forever. Self-limited arthritis, true. That patient, not only could they have self-limiting arthritis, they may have self-limiting arthralgia as well. So they'll have that, pain in the joints and itching. That rash, they'll experience pruritus, they'll have itching. Now, what we won't see is Stevens-Johnson syndrome. Stevens-Johnson syndrome is a very potentially lethal, deadly skin disorder, and we see that as an adverse effect for lots of medications, including antibiotics. But that is not a sign and symptom that we see in fifth disease. Herpes virus 6. This is the agent that causes which disease? Is it measles, rubiola, mumps, exanthem subunum, roseola, or pertussis, whooping cough? Herpes virus 6. What disease does it cause? Okay, most of you guys chose measles. We're going to talk about measles in part 2, but the correct answer, guys, is roseola, exanthem subunum. That is caused by herpes virus 6. Select all that applies. What are the signs and symptoms of roseola? Persistent cough, high fever, rash starting at the trunk and then spreading to the neck, face, and extremities, inflamed pharynx, cervical lymphadenopathy, inflammation of the upper respiratory tract known as coryza. What do you guys think? And you can answer more than one. This is select all that applies. Okay, all of them. You will see all of these signs and symptoms in roseola. They're going to have that persistent cough. And guys, I want you to pay attention. You see this word persistent? As a nursing student, when you are reading the textbook, or maybe you have a test question and it says that, stop. Why would they put that adjective in front of cough? They just could have said cough. The reason they're saying persistent cough is to let you know, okay, well, the patient had a cough and we did what evidence-based practice has shown us to give for that cough, and that cough should be relieved, and it's not relieved. That's why they're calling it persistent, okay? So persistent cough, high-grade fever, rash, and this is another one that's important. NCLEX expects you to know the development of the rash. It starts usually at the trunk and then it spreads to the neck, face, and extremities. They're going to have inflamed pharynx. They're not going to want to eat or drink anything. Cervical lymphadenopathy, those lymph nodes are going to be swollen, and they're going to have inflammation of the upper respiratory tract. And we are down to our last question, true or false? Nursing interventions for exanthem subunum, roseola, is to use standard precautions, give antipyretics and fluids. True or false? Patients got roseola. Are we going to use standard precautions? Are we going to give them antipyretics? Are we going to give them fluids? True or false? True. We're going to use standard precautions with them. Because of the high-grade fever, we're definitely going to give them antipyretics, and we don't want that patient to become dehydrated, especially when we're talking about pediatric patients. When we're talking about the very, very young, our pediatric patients, or the very, very old, the geriatric patients, they will be at high risk for fluid and electrolyte deficiency, at high risk for dehydration, so we definitely want to keep that patient hydrated. So let's take a look to see how you guys did. Third place. Chriselli, congratulations, second place. Hannah, good job, first place. Drum roll. Gabby B, awesome, first place. Runners up, Maria, fourth place, and Elay, fifth place. Congratulations, you guys did a great job. Guys, those who are watching on YouTube, please, if you haven't done so already, be sure to go to my website, nexusnursinginstitute.com, and check it out. I have audio lessons available, and you can now book an NCLEX review with me. Thank you so much for watching this video, and you guys will catch me on the next video.